My name is Denise Lopez, and I'm the Public Health Laboratory Director at the Tulare County Public Health Lab. I've been there for 17 years. I went to Fresno State for my bachelor's and my master's, and I got my doctoral degree from the University of South Florida. So out of high school, I wasn't really sure what I wanted to do. I went to school locally at College of Sequoias, and while I was in my second year, during my biology class, my instructor mentioned the Clinical Laboratory Scientist program, the CLS program, and that sounded really interesting. So that was where I headed with my bachelor's. When I was done with my bachelor's, I got a scholarship at Fresno State to keep going with my master's degree. Yeah, so when I was going to school and throughout my life up to that point, my interaction with the healthcare system was with my normal medical doctor, or if I had to go to the hospital. And so I really was not familiar with the public health system at all. It's a system that largely operates in the background and works with partners. And so it wasn't until the second year of my master's degree, when there was an opening for a public health microbiologist at our local public health laboratory, that I even realized that it was there. And once I started doing research in what public health was and what public health laboratories do specifically, I became fascinated with the mission and with the science, and so that's what sparked my interest and how I entered into that career. Internally, we may be tackling the priorities of the day. I may then have to hop on a call with the CDC or the state to give expertise and technical inputs. So there's a lot of different opportunities to utilize a lot of different skills every single day, and that's one of the things that I really enjoy about my career. So a public health laboratory director is responsible for the leadership of the laboratory team. They're responsible for providing direction as far as laboratory services, what services should be provided, ensuring a high-quality, safe laboratory that is keyed into the mission of the local public health department, and making sure that it's delivering services that takes care of the needs of their specific community that they serve. Our interaction in the laboratory is largely with other members of the medical community. So we may field calls from providers and nurses that have questions about laboratory services or perhaps specific test results. Although our health department has a lot of interaction with the community, and they use that interaction with the community to inform their public health assessment of the community's needs, and then we incorporate those assessments and those needs into how we develop our laboratory services. So I really enjoy the science behind the work that I do, technology that is always changing, that we need to keep up with, but mostly the people that I have an opportunity to work with, the team here at our laboratory, the other members of the medical community, our providers, our partners. It's really very rewarding to work together to do what we can to try and promote the health of our community here. Believing in the mission is really important, and that's really rewarding. It's also very challenging. We have constant public health issues that we are always trying to address, and then there are new and emerging issues or public health emergencies that we have to pivot and redirect our resources to. Ideally, if we are staying on top of global health news and things that are happening around the globe, we can see when there are outbreaks occurring in other countries, infectious diseases that have the potential to cause outbreaks here in the United States. We make sure that we're staying on top of that information. Anything that we can do to prepare ahead of time, we're doing that. We're incorporating that into our day-to-day activities. And then if something does happen, then we work together with our community members, with our hospitals, our clinics, the other members of our public health team. Often we'll work with the state, sometimes with the CDC, and it just depends on what that response looks like, what our laboratory-specific role might be. We may be the laboratory that's actually performing the testing. It just depends on the outbreak, the specific pathogen, what our role will be. Every public health lab is tailored to the specific needs of the community that it serves. Laboratories that serve populations with very high endemic rates of valley fever may specialize in providing valley fever testing. So every laboratory really needs to be dialed in to the needs of their community, any gaps that exist within the healthcare system, and then tailor their services to meet those needs. Working with the team that we do and working at the population level as opposed to the individual healthcare level, that's very rewarding. But also for the public sector, at least in our laboratory, we have flexible scheduling that our public health microbiologists and support staff are able to take advantage of. And all of that allows us to have good operational periods with our laboratories. And it also is a good balance with allowing our staff to have a good work-life balance. My most memorable experience in public health so far was probably the initial weeks of the COVID-19 pandemic. That was one of the examples where our laboratory was one of the few laboratories in California that was able to provide that testing. We worked together, our team and our public health team and our agency, to prioritize testing for those that needed it most. Watching our team rise to that occasion and work together and really lift each other up and support each other, and also be very effective with scaling up and delivering those services. That was very inspiring to me to see that. We always encourage students to reach out to us, even if we don't serve their community directly, and ask about opportunities to take a tour, to be able to volunteer, to job shadow, for internships, and really just starting off with a tour to learn more about the laboratory, to see what the setting looks like, what the equipment is used to meet microbiologists and talk to other personnel that work in public health labs. I would say you are in for a very interesting and rewarding career, and you're going to work with an amazing team for an incredible health department, and that there's a lot of great things to come in your career. There are a variety of different careers at a public health laboratory. We have our public health microbiologists, which is what I started out as, and they are the scientists that actually will work out on the bench. They will work using equipment like microscopes, or they might be performing molecular testing using PCR. And so they will be the ones that will analyze samples and determine whether or not infectious diseases are present. They're often the individuals that will talk to doctors and nurses to explain results and what they mean. And so our public health microbiologists are the core of our testing team. We also have our support staff members, so we have laboratory technicians and laboratory assistants, and so they perform the supportive functions. So our laboratory technicians might assist with getting the samples set up, with staining slides, with preparing reagents. Our laboratory assistants will help with getting the samples checked into the computer, to ensuring the quality is there, to make sure that they're labeled properly. Each individual role has different educational requirements as well. So our laboratory assistant requires a high school diploma. Our laboratory technicians require some additional expertise, additional years of experience. Our public health microbiologists require a bachelor's degree. And then, as I mentioned, for laboratory director, that is a doctoral level position with 2 national board certification exams for laboratory director. But there are often ladders within the laboratory where someone can start at a lab assistant or lab technician, and if they want to continue to go to school and to continue to take on different roles at the laboratory, that they can move on to different roles. There's a lot of different roles and different opportunities to participate in the exciting field of public health laboratory science.